For your third pregnancy and birth of baby C, are you going to do a VBAC or are you going to go back to a C-section? Tell us why.
Kids love him. Can't you tell by his scarfing?
Saturday night, Cara and I can go to dinner.
Gemma may or may not be massaging Pumpkin with
Guys, when Dad's in charge, we have meatballs because they're easy.
And the kids love him, huh, Royal? Can't you tell by his scarfing? Good job.
Guys, good news. We are so stoked. My sister said that she will come by and stay with the babies. Saturday night, Cara and I can go to dinner. We're gonna go get some delicious food at one of our favorite places. But first, quick bro day right now.
Guys, Gemma may or may not be massaging Pumpkin with a vibrating toothbrush.
Her fur not good.
Oh, and does he like it?
Pumpkin, your fur's not good.
Yeah, it actually feels good. It's like soothing. It's like a little massager.
Pumpkin. Sweet boy. The first time I called him a boy. Yay.
Dad, you're messing up my tickers.
Oh.
What can I put my tickers in? Maybe I can put them on you.
Oh my gosh, you're so funny.
But I can't tick on you. Can I tick on this?
Okay. Guys, the whole family is here. All of us. Nope, we're missing a lot. But Gemma's with us tonight. We put on a show for her and she said, I want to be with the family and talk. She said,
I want to film.
She said, I want to film. We're like, okay. Cutie.
Don't
She's putting
ever.
stickers on my leg.
Okay, I could put them everywhere. Well, Punto
They're
and...
not really sticky though. They only stick to this.
Oh yeah, oh yeah.
Well, Dad,
Okay.
Merida not goes there. Merida is shooting.
Okay, here, you can do this and meanwhile we're gonna talk for a second.
Hello.
Guys, we have some stuff to talk about. Cara, tell us, Mom.
Tell us, Mom.
Gemma say, tell us, Mom.
Tell us, Mom.
Oh, that wasn't easy.
Tell us, Mom.
So, question about the birth that I get a lot is if I'm going to have another C-section or if I'm going to be able to do a VBAC. If you don't know what a VBAC is, if you don't want to talk about birth,
Merida shooting.
Well, this is what people came to see because I think a lot of people, especially if they're having their first child, they always wonder, like, am I gonna do a C-section or a what do you call it?
VBAC.
No, VBAC was the first time.
Oh, just a vaginal delivery.
Oh, okay. I just didn't want to say it.
That's what I'm saying is that word. If you don't want to hear it.
So the regular birth way, I guess, I don't know. Or a C-section. So Cara's gonna shed some insight because this girl happens to know a lot about birthing babies.
I have done both.
She's done both and she has a preference, I think.
So with Gemma, I just had a normal delivery, vaginal delivery, and it was smooth sailing. Okay, we had to get rid of the little nugget because it was hard having to keep talking.
She's
over
so cute.
her.
She just like plays with her stickers, but she can't help it. She has to
She
role
has
play.
to be talking.
And so she role plays and like she just, it's so cute. But yeah.
Okay, so Gemma's birth was amazing. I just did like normal vaginal delivery and I actually went in to get induced, and while I was in the hospital laying in my bed, I rolled over and my water broke and I went into labor, like in the hospital. So I never even started the Pitocin, and I had her like quickly. That was at like 7 a.m. and she was born at 1 o'clock. I did get an epidural with her, and then I think I pushed for less than an hour.
I'm gonna be the person that asks the questions as if I'm you guys. I'm gonna think what you guys
You're
might
the
ask.
interviewer?
Mm-hmm.
Okay.
So what made you choose to get an epidural? And what does that feel like when you actually get it? Because we all know that it numbs everything. What's the feeling of the actual...
I was actually really nervous to get the epidural because I'm afraid of needles. But when you are in labor, you're not so scared anymore. I was like, Darik, get the nurse. I want the epidural now.
I know, she was nervous, but then, yeah.
Yeah,
then she's
in
like,
the moment,
just
you're
give
just
it to
like,
me.
Except this guy goes, that needle's so big.
Not to scare anybody, but I was like, what? Where's that?
And
That's going in the
they
spine?
were like, top because I'm like bent over, like about to get it.
Oh yeah. Like
Leave it to Darik. Yeah, I had like the best just experience with her. They were like, you better watch out for your next baby because I had her closer to Salt Lake. They're like, you better watch out with your next baby. You might have it in the car if you wait too long to come in.
that would mean that I would have to deliver it.
Yeah.
And I would not know what to do.
But then
I would just be like,
the next babies ended up being the triplets. So I didn't go into labor with them and have them. I had a planned C-section. We knew that no matter when I went into labor with them, I was going to have to go in and have a C-section. We scheduled mine for 34 weeks and 5 days. We didn't actually expect me to get to that date. They thought I would go into labor on my own before then, and then it would be an emergency C-section, but just because you like would just go right in and get it right away. But we made it to our scheduled C-section. So for me, like the difference, I like the experience of pushing out a baby better than being in like a cement cold operating room on a table. It just was like so scary for me. Like I was more scared of like the C-section part because I've never broken a bone. I've never like had stitches or surgery or like that kind of thing. So just like the thought of going into surgery like that was scary. And being awake, I kept asking if they could just put me under, but they said no. Like, please, can't you just knock me out and wake me up when it's over?
There's something soothing about being put under. It's like you fall asleep and you wake up and everything that's, is done.
But they're like, no, you want to see your babies coming out. I'm like,
so guys, the C-section, because I was there, I witnessed the whole thing. It was extremely quick compared to Gemma's.
Yeah.
Couldn't believe it. They're like, all right, here we go. And
30 minutes in and out.
Yeah.
With,
30 minutes to
rolling me into the room to rolling me out of the room was 30 minutes.
30 minutes and 3 babies are born. So like C-sections are quick. You didn't talk about this, but Gemma's birth, that's another thing is that, when you do it that way, it's, it's like push, and then like the doctor is like, I can see the baby's head. And I think the head is like halfway, out. But then the doctor had to go to an emergency C-section. He's like, there was an emergency C-section in the hospital. They came and grabbed our doctor as he's delivering Cara. And so like, he's like, all right, so he's split for like, I don't know.
I hadn't started pushing yet, but they said I was ready to push. And then he had to go do an emergency C-section.
Okay. Either way, it made
her head got jacked.
It made it. This is crazy, you guys. So this might happen to you guys, and don't be scared because we were a little bit. But since he had to go do an emergency C-section and was gone for a little bit, when he came back and there's maybe like a 20-minute, 30-minute delay there. Then she delivered, but because of that, Gemma was already in the birth canal, so her head was kind of getting formed.
She was in the birth canal, and I was having contractions, so I think it was just like.
So she came out with like, and I think this is somewhat normal, or sometimes it happens often, but she had like a cone head. Like,
and we're not saying like it was a little misshaped. It was like a second head on the back of her head. We
thought it was like a.
So
we were like,
squished.
oh my gosh, doctor, what is that? But the doctor, the first thing he did, he's like, oh, look at that little cone head. That'll be gone by tomorrow. That's what he said.
It wasn't gone by. It took about 2 months for her to go.
Okay. Anyways, maybe ours was a little worse than normal, but it's because of an emergency C-section. Like he had to go somewhere. So I kind of feel for the doctor. Like he's giving birth and got pulled away for like an emergency. Maybe, I don't know. Hopefully that mother was okay. So we were a little startled at first, but just know that can happen.
If they have a cone head, it can go back to normal.
It goes back to normal 100%.
And I know hers was bad because the nurses that night were trying to get a hold of like the on-call doctor to prescribe her pain medication because it was like black and blue. It was
purple.
Yeah, like the back of it was so bruised. And they gave her a special gel pillow so she could lay on her side.
Yeah, so me and Cara, like this is our first child. We were just like,
what happened?
Our poor baby looks like her head hurts so bad.
Yeah.
And at first we were like, why did the doctor have to leave? But then we're like, oh wait, it was an emergency. Like,
yeah.
That's the thing. And so yeah, you won't have that stuff with a C-section. Obviously, like C-section is just like lift up the flap, pick him up out, put him on a pillow.
Yeah.
They don't have to go through his canal and just
they
like
had perfectly
squish
round
him.
heads.
Anyway, yeah. So I guess it's less trauma on the baby for sure to do a C-section, but more healing on the mother part.
Yeah. So yeah, that was like the difference in experience. It's just completely different going into surgery versus pushing a baby out. I got a spinal block, and like when you go in for the C-section, like they had me get the spinal block while he was getting his scrubs and scrubbing your hands and everything. So I had to do that alone, which was like really nerve-wracking for me. Also, the epidural and the spinal block, like they really aren't bad to get. When you get them, like I feel like people make it out to be like really scary. I was scared going into it, but it actually like didn't hurt. You just feel like pressure pressure and like a pop and like, but it's not like painful. So that was.
I can't really,
I mean, maybe for some people it is. Everyone has different experiences, but for me, it has never been painful to actually like get it. I was more scared for the spinal block because I wasn't in labor, so I was like just sitting there, not in labor, like getting it. Where with epidural, I was like, get it in there.
I know, and like,
but the spinal block was like smooth sailing, didn't hurt. I didn't even like, wait, you're done already? So that was good.
when I got my epidural, I didn't feel like that actually.
Oh my gosh,
Felt-
you couldn't handle childbirth.
She always says I couldn't handle an epidural, or not. I
No.
couldn't handle childbirth, and that's
I always
true.
say you couldn't handle pregnancy.
Duh. God knows everything. That's why he put
He
me
gets
on
like
earth.
little man colds.
That's why I can't birth children, because he knows that I couldn't handle it.
But maybe if you had to, you'd be able to.
True, exactly. I think God puts you. He knows what's right for everybody. He doesn't give you anything you can't handle. So therefore, women have to give birth. 'Cause we can't.
So I guess recovery, the difference in recovery, TMI tore really, really bad with Gemma.
So hold on. Can we just let's just say this is like real information for you guys. A lot of moms. There's probably a lot of people that are pregnant that watch our channel, or a lot of moms, or future moms. Just know that this is in no way supposed to and shouldn't scare you. There's stuff that happens, but like you guys can get through it, and don't let this discourage you in any possible way. Just know that like you can do it.
Just fine.
You'll make it out just fine.
Yeah, I made it out just fine.
That being said,
But this is just my recovery process between
Yeah.
the two. I tore really bad with her, so my recovery was a bit longer. I think it was probably about 2 weeks before I like felt pretty good and normal. So I had to get a lot of stitches. And
but you didn't feel it.
What?
Like the epidural, like you didn't feel any.
I didn't feel it
You didn't
happening.
even know you tore, right?
No, I got an episiotomy and then I tore past it. So it was bad. But
We're not going to go into what that is. Just
I didn't
Google
feel-
episiotomy.
I didn't feel it when you're recovering though. Yeah, you have to keep up on your pain meds.
For sure. The recovery is almost like,
But
it's like a mini C-section, right?
No. But with the C-section, you just had like a major surgery. But I feel like I was recovered by my C-section for the most part, like weaning off the pain meds. I was picking up the babies, even though I don't think I was supposed to, or Gemma, by 2 weeks too. So I feel like the recovery time for me was like pretty even, but the C-section was just like way more intense. But by 2 weeks, I felt pretty good both
It seemed
times.
intense. Yeah, for sure it was intense. But I mean, the recovery? Yeah, the recovery.
Yeah,
Sorry,
like I
I'm
couldn't
talking
even
about-
climb in and out of bed.
Yeah.
So I do prefer the delivery recovery over a C-section recovery because it just is a lot more going on. I mean, they like had surgery.
This is a question from user 2665. I'm trying to think what you guys are going to ask. Were you given the chance to do the triplets vaginally, or did you?
No.
And why? Did you get an opportunity or a chance, or did they make you do a C-section? That's my question.
At most, just go for the C-section. I think if you really wanted to try, I've heard of people delivering triplets. I've heard of one person that delivered triplets.
Right, but isn't it like a
And I think
super
you
high
would-
chance that like they get halfway
It's-
through and they're like,
Yeah,
"All right,
it's really high
we just-"
risk to have to just because there's so many, they can move, they can Wren was breech, so I wouldn't have even been able to deliver her. They would have done I would have gotten 2 out and then had to have a C-section anyway.
Yeah.
So it's just more high risk, and because they are always preemie, it's just more dangerous and hard on the baby to be delivered when they're not full term. It just is more high risk all around to even try that. So
Yeah.
that's why everyone, for the most part, just opts for a C-section
So that's a very good question.
with
user
high
665.
order multiples.
So I remember the nurse was saying if Cara really, really wanted to, she could have delivered them, naturally, but
No, I don't think so. Wren was breech.
well, she said
They wouldn't. My place wouldn't have let me.
Yes, but
I would have had to find
I distinctly remember him saying any time that were to happen, it's such a high chance that that you have to go into an emergency C-section, and it's
Yeah.
it's so much easier just to plan for a C-section, so you don't have to do an emergency, because in an emergency everyone's scrambling, and then it's more stress in the room for everybody, which is
And when the
passed on to the
triplets
babies.
were born, they were so set up and ready for them. They had 3 NICU stations in the operating room. There were, how many people were even in that room? I think each baby had 4 people for themselves.
Oh, yeah, each pod.
The room for having triplets, even just with a normal C-section, I think there's a lot of people. But I think because they knew we were going to have NICU babies, and triplets, I think they had 4 people at each baby station. So there's 12 just standing on the side of my bed.
So we were so grateful to see how many people were in there. But
I had 2 doctors, and then they had all their assistants, the nurses. I had the anesthesiologist with me.
yeah, it's nuts.
There were people. It was probably almost 30 people were in the room.
Yeah, and it's crazy. So it's they probably sent out a email for the company wide
The triplets are coming.
Triplets are coming. Everyone come to work.
Yeah, and
It's
even
just nuts that, like, how many people are involved with 3 babies being born at once.
even in the NICU, they had a whole corner, like especially, I mean, if you've seen the vlog, you know, like they had the bed, the corner one, and this room, and they said they'd had them like reserved and waiting because they knew the triplets were coming soon. They were like so prepared for them to come.
They were super awesome. We appreciate everyone at the hospital. It shows you how much goes into bringing a child out, let alone 2 or 3.
Moving on to what I'm doing this time.
Oh, hold on. That's the next question. User 6622571 says, like her first one.
Yeah, for like.
Wait, wasn't it
she didn't
because
have a
her
reason.
mom always did
Her
that?
mom, I think, had C-sections and told her it was good, so she just like had a C-section.
Honestly, they're both good. There's not a wrong or right answer.
Just getting your baby here safely is
the best
what
option.
you want to do. Just for me personally, I prefer delivering, and I think it's just because I'm really squeamish too. I was like really nervous going into my first appointments because I just like really wanted them to tell me that I could do a VBAC. I actually didn't think I'd be able to because I thought that my C-section was cut differently where I wouldn't be able to do a VBAC. But then they told me that I was a perfect candidate because of Gemma's birth, and she was full term. She was actually 2 days late past her due date. She was a big size baby, and then because my C-section was only because it was multiples, it wasn't because of like complications. So they said I was a perfect candidate to do a VBAC, and that's what we're planning to do. And I'm really excited. It is considered high-ish risk because I have the scar on my uterus. So contractions, very unlikely, but could possibly cause like uterine rupture where your scar is, your contractions get strong and it like opens your scar back up on your uterus, which obviously would be really bad and dangerous, and you'd have to like go in for emergency surgery. But it's a low percentage, low chance. And I have multiple friends who have had VBACs and they're successful and great and a good experience.
That being said,
So
you guys trust me, as the husband, I'm like, okay, Cara, we're gonna do whatever is the safest for like you and the baby, because like this guy couldn't imagine anything happening to you. Okay, I need you here. So that being said,
I am very, you guys probably know, like I'm just kind of like, oh, whatever, everything will be fine, like pretty laid back with stuff. And even when I like had Gemma, I was not even nervous. Like going in, I was just like ready to have my baby. With the triplets, I was nervous about the C-section part, but I wasn't nervous about like surviving. This time, I feel like I've kind of had, anxiety about it.
Maybe
I think
a little
because I
more than
have
normal.
so many more kids who depend on me now, like I have all of these babies that like need their mom, so I don't know if that's making me more nervous just about the whole birthing process. I'm trying to just like stay positive, keep my eye on the prize, and just getting this baby here. But I do like sometimes just get nervous, like what if this happened? What if this happened?
I always feel, and if she's doing that, I think I'm a little worse.
He's worse for sure. So if I start talking about it to him, he's like, stop.
Yeah, like so, like I don't know. It's like my biggest fear for sure, because like I couldn't. I couldn't live without you.
But we're gonna be fine. Everything is
No, it'll be
fine.
fine. It will. But I would say it's a little more nervous
It's
this
just
time
scarier
around.
than the last two.
Yeah,
I
for
feel
some
like.
reason it is. Gemma.
Come
Come here. Let's give you a hug. Come here.
Can we some food so I can get better?
You just ate a bagel and cream cheese.
Well,
She wants some food so her tummy can get
that
better.
hurt.
Do you need
So
some
yeah,
more?
chat fam, that is what Cara's gonna do for this next pregnancy. And so, hey, put some feelers out there, guys. Make sure to put some good vibes in the air for Care Bear. Just make sure she delivers safely.
Let's hope he just comes smoothly, quickly, no complications.
It is a small chance that there's a complication, but yeah, anytime you go from a C-section back to a VBAC, there's a possibility of that happening. That's not gonna happen. It's not going to happen. It's not going to happen there. The universe knows. We have the camera sitting on our bassinet box.
Yeah, it's
so
perfect
if you
height.
breathe, it's
it's
very
really
flimsy.
I'm really excited that I get to do the VBAC because that is what I wanted.
My tummy hurt. That makes cereal.
Okay, come
She
here.
needs cereal.
Come here, I'll give you a hug.
She just
Let me
had a
get you
bagel
some-
and cream cheese.
Oh.
Gemma,
do
is there a
shoutouts.
baby coming to our family?
Yeah.
Yeah.
Guys, let's do shout outs real quick and we'll let you guys go.
When
Night.
I am touching.
My shout out goes to Carla Froing. So Carla Froing from Germany. Thanks so much for
Yeah,
watching all the way
right.
from Germany, supporting our family. I have a
But-
sticker. Okay, I have Rapunzel on my phone.
Here, I'll get it.
Okay.
I'll get it. It's very tasty.
Oh, this person said, can Gemma say hi?
Oh,
Hi.
say Alexis
I'm Alexis.
Gould.
Alexis Gould. Say hi, Alexis Gould.
Hi,
Hi,
Can you
Alexis
say
Gould.
it clearly?
Hi, Alexis.
She's tired. She's mumbling.
Hi,
Alexis, thank you for being part of our family.
Thanks for being part of the chat fam.
Wait, do I have on me?
What do you have on you?
Like itchy.
Is it itchy?
A black pot.
I think it's just a shadow.
No, like something on my forehead.
Look at me.
See.
Look at me. Let me see if I
Did
can
you color
see
on yourself?
No, it hurts when you do this.
Do you have a bruise? It must be a bruise.
We love you guys. We'll see you in 2 days. Put some prayers out there that Cara delivers safely.
Oh, wait. Let's tell them about last night really quick.
Oh, go for it.
Last night, I did my maternity pictures with Blake, and we kind of hiked up a little hill. Nothing too strenuous. I think that might be what put me over.
This guy's shaking his head because I'm like, why'd you do that?
It was, first of all, we didn't know where we were going to shoot. We just went
True,
and found a
true.
location. We didn't plan it.
True.
And then something happened to me.
We get home, and I'm going to return the dress that I used for the shoot. So we're driving to return the dress, and I started just having Braxton Hicks, which I've had like a tiny bit, which is totally normal. I actually haven't had very many. So I was having them in my, it's just for your belly. If you don't know what Braxton Hicks contractions are, they're like, they're your body practicing for contractions, but they're not real contractions. They don't hurt. You just get really tight, and then they like loosen up, and you're good. So I started having those, and then I had them for like over an hour.
She had
just over
She
an
had
hour.
like 15 of them.
I had like 15.
And like, I was freaking out. Like, dude, are
We were
you
like
going into
Googling
labor?
it, and it said you should have like 2. They should last maybe 30 seconds. If you have more than 8 or something, 12 in an hour, like call the doctor. But then Darik was Googling, what did you Google? I don't know. He was
I
like,
just Googled what to do if you're having a lot, and it said drink a lot of water. So
yeah,
I
he's
gave
like,
her a
if
ton
you're
of water.
dehydrated, just drink water. So he got me like a huge mug. He made me get in bed, put my feet up. It said to put your feet up, and then he like did all the baby nighttime routine and put them to bed. And I didn't get out of bed from like 8 o'clock until like 8:30 the next morning.
I know, she slept a
But
lot.
they stopped right when I got in bed and started drinking water. They stopped.
So if you're having one of Braxton Hicks contractions, drink a lot of water, get off your feet, relax.
But when we were driving, I was like, it keeps happening, Darik. They don't hurt, so I don't feel like I'm like going into actual labor, but it's weird. Are they going to turn into labor? We were kind of freaking out a little bit because we still don't have diapers, and I don't have my hospital bag packed. And now I realize this week that is my to-do list.
So that happened, you guys. So we love you guys. Stay safe. We'll see you in the next video. Say bye, Mom.